I'm Doug Storey. I'm the Director for Communication Science and Research at CCP. I've been here since 1993, and I'm also on the faculty in the School of Public Health. I'm an associate professor in the Department of Health, Behavior, and Society. I've worked all over the world in sort of many different health areas, ranging from adolescent reproductive health to environmental communication to family planning and malaria and emergency preparedness, HIV, for almost anything you can name I've worked on at some point. My background is in communication research, journalism and communication research. And I've been fortunate that I've been able to apply those skills in the area of health and development communication for a long time. Well, theories, models, and frameworks are all possible explanations for why people do what they do. I think it's important to acknowledge that in the academic world, a theory is usually a bit more formal. It refers to an explanation for some kind of phenomenon, behavior, or a social practice or something that has been widely tested and validated in a lot of different settings. Models and frameworks are also explanations, but they tend to be a little less formal and perhaps less well tested in the real world. But when we talk about theories and frameworks and models in the work that we do, we use the term a little bit differently. We're not talking about a formal academic theory. We're talking about an explanation for a behavior that you can use in your program. So theories or models are explanations that you yourself develop based on what you know about your audience. And so they depend on having good data, previously collected data or data that you collect yourself that helps you explain what people do and why they do that. Sort of another way to think about it is that theories and frameworks and models are sort of like hypotheses. When you are starting to design a program and you're trying to develop a theory that would guide your program, you can use theories and the concepts that are in them to help think about the strategy for the program. And so your theory or your model, your framework for your program should be an explanation based on the data that you have from your own audience and your own program context. So we call that a program theory or a theory of change. But those are theories that you yourself make, often inspired by existing theories and models and frameworks. Again, I think it's helpful to think about theories as sort of tools for planning, tools for thinking. There are a lot of formal theories that are out there, like the theory of reasoned action, or the diffusion theory, or social learning theory, or risk and efficacy theory. And you can use all of those for inspiration to think about what might influence your audience to behave in one way or another. Each theory has its own emphasis. And these, because these are developed by scholars, by researchers, by professionals in our field, to explain certain things that they're interested in. And so different theories have different emphasis. For example, the theory of reasoned action focuses mostly on what people believe about two things: what they believe about what will happen to them or the consequences of a behavior. So if you choose to stop smoking, right, what will happen to you? How will you feel? Will it be hard to do? Will you feel physically ill, or will you feel good? Will you feel healthier? Right? And second, beliefs about what other important people in your social world would prefer you to do. So what does your wife want you to do? What do your kids think about your smoking behavior, right? And how motivated are you to comply with what they with what they would prefer you to do? So reason action has those two things: beliefs about consequences and beliefs about what it's called subjective norms, what other people around you, significant others, want you to do. By comparison, another theory or a model that we use often is called the extended parallel process model, EPPM. And what that focuses on is the the interaction between emotion and reason. So, for example, are you afraid of HIV/AIDS? Right? Do you feel that that's a threat to you? You know, how bad is that threat? Could it happen to you? So that there's that emotional or threat component. And then the efficacy component of EPPM refers to whether you have confidence in your ability to overcome that threat or eliminate it. So do you believe, for example, that using a condom can prevent AIDS, prevent transmission of HIV? That's called response efficacy, right? Do you believe that there's a solution that works? And second, do you believe that you can do it, right? Can you use a condom properly, effectively, every time you have sex? Right? So the EPPM focuses on that combination of threat and efficacy. And other theories have their own emphasis. So when we think about using theories as a tool for thinking or for strategy development, for program design, you should be familiar with the different theories and what they emphasize. And then you can reflect on what you know about your audience and the situation in which they live, and choose the bits and pieces of theories that match that situation. Right? And that's how you can build a program theory. So in most cases, we don't use a formal theory to drive a program. We think first from the data. What do we know about our audience and what influences their behavior? And then we consider the theories to help us think about whether we're forgetting something, whether there are other drivers of behavior, other determinants that we should consider, that we should maybe incorporate into our strategies. So the important thing is that you don't start with a theory and try to fit it to your program context. You start with the context, and then you use the theories to sort of try to disentangle or take apart and put back together how you understand the behavior you're trying to influence. So as I said a minute ago, the starting point for any kind of program is an understanding of your audience, of what they currently do and what motivates them to act or not to act in a healthy way. So the theories that I think it's important for us to be familiar with a variety of theories that describe a variety of influences over behavior. As I said earlier, some theories focus on threat and efficacy, some focus on beliefs, some focus on norms, some focus more on social influences and how the people around you affect your behavior. Some theories even focus on macro-social issues, the structure of society, the structure of communities, and relationships within a community. So it's important for you to first think about what you know about your audience and about the situation in which they live and and behave, and then use the theories to help sort of analyze that situation, to think about what might be the most important factors or drivers or variables for your particular program. So, how do you do that? How do you sort of marshal these theories, bring them together? A really useful tool for most of us at CCP has been the Pathways to Health Competent Society. We often call it the Pathways model. It's a It's a multi-level model that CCP developed back in the 2000s, around 2003 or 4, and it describes levels of communication at the individual and family level, at the community level. It describes communication within service delivery systems, like in hospitals, or communication with healthcare providers. It describes communication at a policy level or a political level. And at each of those levels, there are a lot of variables that you may consider in the design of a program. So the pathways model is sort of, when I teach my students about this, I describe it as a kind of Chinese restaurant menu of theories. It's, when you go to a Chinese restaurant and you open the menu, there's everything under the sun that you could possibly want to eat, but you can't eat it all. So you have to think carefully, what do I want to eat today? You have to prioritize, right? So the pathways model is a little bit like that. It has theories, it has variables and theories from a lot of different sources. And you can use it as a kind of checklist to say, have I considered this? Have I considered that? Have I thought about risk perception? Have I thought about social norms? Have I thought about about access to health services? Have I thought about policies that influence the health or development issue? And so it's a kind of checklist, or a kind of a roadmap for what you might consider. And by using that, you can identify the things that may be most important for your particular program. Another important use of theory is to guide the formative research that you might do for a program. So as you're starting to design a project, and you're thinking about the audience and what influences their behavior, you may need to do some research to clarify what you know about that audience and that situation and that particular behavior. So the theories can suggest to you what you might include in your research, what kinds of questions you might ask people in order to determine which of those variables or concepts are most important in predicting their behavior. So we sometimes talk about doers versus non-doers, people who practice a healthy behavior and people who don't. And then we can conduct our research, we can do formative research to understand what makes those people different. Right? So what's different about people who protect themselves against HIV? What's different about people that always wash their hands before cooking? What makes people who always sleep under a mosquito net at night different from people that don't? And often those differences will come from will be reflected in variables from our theories. Right? So if we ask the right questions that are inspired by theory, we can then see what predicts that difference between doing a behavior and not doing a behavior. Well, the simple answer to that is that you need to collect some data. If you think about your program or your theory of change as a kind of hypothesis, as a kind of prediction about why a program should work, then the way to confirm your hypothesis is to collect some data and see if, in fact, people who are doing the behavior or are responding to your program in a positive way are doing it because of those variables or those factors that you predicted would influence behavior. So having data from your audience is really important. This is why we try to emphasize the collection of monitoring data so that you can track what people are being exposed to and how your program is influencing the outcomes, as well as impact evaluation data to test whether, in fact, your program hypothesis is confirmed by the facts. theories and models are always evolving. The field is always advancing because academics, scientists, health professionals are sort of constantly thinking of are sort of constantly having new insights about what works and what doesn't work, and how we can be more effective in the work that we do. So theories are always changing and growing and evolving as we add new variables or new concepts to our to the work that we do. But to be honest, old theories never go away. It's not as if an older theory is kind of kicked to the side and never used again. In many cases, our newer theories are a combination of bits and pieces from old theories plus some new insights, new things that we've discovered are important to consider. So they're constantly evolving. And to be honest, you all can be a part of that process by thinking creatively about what works in your particular location or for your particular audience and behavior. And you may contribute to the growth and the evolution of theories. Some of the newer ideas that we're seeing in this process of evolution are, for example, more emphasis on social norms and on normative change. Now, the idea of norms has been around for a very long time, but in the past 10 years or so, people have become more sophisticated about the way that they measure norms, the way they think about norms, sort of different kinds of norms, like injunctive norms or norms. Injunctive norms refers to what you think other people want you to do. Descriptive norms are norms about how common a behavior is and sort of how common you think a behavior is. A collective norm is simply how frequent the behavior is, whether you perceive that or not. So we've become more sophisticated in the way we think about norms, and that's a new development in our field. Another development that's worth thinking about is the growth of multi-level theories. Now, what that means is a lot of our theories in health education, health communication, have focused on individual level behaviors. So what do we know about what affects a person's choice to eat a healthier diet or to exercise or to immunize your children or to use contraception? But those individual level variables and behaviors are influenced by factors at a higher level. So they're influenced by the structure of your community and your interactions with friends. They're influenced by the quality of services that are available and provided to you. They're influenced by policies and regulations that influence how services are delivered and how food is processed and managed in society. So there are these higher level variables that influence individual behavior, and some of the newer developments in theory try to put those levels together into a multi-level model so that we consider not just individual level beliefs and attitudes and so on, but also the social and structural factors that influence people, regardless of what they believe. So multi-level theories is another newer area of development.
Mm-hmm.
Well, as I've said, I think normative change theories are very important these days. There's a lot of attention, a lot of research being done. A lot of people are incorporating thinking about social norms into their programs, and so we're beginning to see a lot more evidence of how normative change works and why it's important. There's a lot of interest these days in what's referred to as behavioral economics. In some ways, behavioral economics is not new at all, but it's drawing more attention to some of the things that we haven't really thought about very much in the work that we do. A lot of the behavioral economics thinking is based on the idea that many of our choices, many of our behavioral choices, are not necessarily logical. We often make choices that seem irrational or seem choices that seem irrational. We often make choices based on what we're familiar with, whether it's a logical choice or not. We often make choices based on kind of unconscious mental processes, predispositions, biases, and things like that we're not always aware of, we can't always articulate or describe. So behavioral economics is sort of looking at these influences that happen sort of deep in the brain that are not always very mindful. So that's an interesting and exciting area of work. And then there are some older theories that are coming back into popularity. For example, in the 1970s, there was an important body of research around communication and behavior called uses and gratifications. And the basic idea is that people choose to communicate based on what they hope to achieve through that communication. So, for example, there are a number of reasons people might want to communicate. You might want to collect information about what's happening, right? You might read the newspaper or go online to find out what the latest news is. That's called information seeking. Another reason to communicate is to express yourself. So you might talk to someone, have a conversation, or write a poem, or make a video on your cell phone to express your own reaction to an event, or to express the ideas that you personally have. Another important gratification is connecting with other people. So you might communicate, you might use your cell phone to talk to a friend, or you might text a friend about something you found in the market, or this need to connect with people is important. And then a fourth major gratification is called entertainment or diversion. Sometimes we go to a movie or we listen to music because we want to be entertained. So uses and gratifications describes these things that we hope to achieve with communication. The uses part refers to how we try to achieve those. So do you use your cell phone? Do you open a newspaper? Do you go online? Do you go to a movie? Do you go talk to your friend in the market? Right? These are all different ways that you might achieve those gratifications. And what's new about this is that some of the newer technologies, social media in particular, cell phone technology, digital technology, provide new ways for us to achieve those gratifications. And so thinking about how some of these new media and new technologies help people to connect, to seek information, to be entertained, to connect with other people, that's an exciting new area of theory and research right now. So I think an important thing to realize is that not all SBC is called SBC. There are a lot of jobs out there that involve the use of communication to improve society in some way, to help people act healthier, or to create change in communities and society. But those aren't always called SBC jobs. So I wouldn't try to plan your career path based on a job search for SBC, social behavior change communication. Instead, I think you need to think about how communication can be used strategically to create positive changes in people and in society. And there are a lot of jobs that may involve that kind of skill. So there are private sector firms that do social marketing, and they may not think of that as SBC, but in fact you are trying to, in a sense, sell healthy behaviors, right? sell positive social behaviors, like recycling or vaccination or accessing services. So that's one one way I think is to think more broadly about how you with your communication skills might make a contribution, whether it's called SBC or not. And so as far as where you can go to study these kinds of things, there are many universities, colleges, schools around the world that train people in communication, communication arts, communication sciences. And almost anywhere you live, you will find some university that provides some training in communication. It might be called journalism, it might be called communication sciences, it might be called media arts. These programs have many different titles. But in considering the one that might be right for you, you should look at how the program teaches theory and research methods in the field of communication. The best programs are the ones that teach you theory and that teach you how to research those theories and to understand behavior and the effects of communication. There are some very good schools in the United States, but they tend to be very expensive. Some of them are there are two Annenberg schools of communication, one at the University of Pennsylvania and one at the University of Southern California. Those are excellent programs, graduate programs in communication. But there are other schools like Ohio State University, Ohio University, where else? University of Wisconsin at Madison. Those are schools that provide communication degree programs. But you can also find a lot of good communication training sometimes in schools of public health or public health institutes. So in the United States, for example, the Bloomberg School of Public Health that we are associated with has one of the best health communication programs anywhere in the world. But it's health communication within a school of public health rather than communication within a school of communication. Around the world, I have to look at my list if you don't mind, because there are many. But around the world, other parts of the world, in Europe, for example, the University of Groningen in the Netherlands has a very strong communication program. The Università della Svizzera Italiana, it's the Swiss-Italian school, Swiss-Italian University in Switzerland has a very good communication program and actually has a specialization in social marketing. If you go into consider schools in Asia, there are a number of Korean universities that are very good. Yonsei University, Seoul University are excellent for communication programs. The Nanyang Technological University in Singapore has a very strong communication and telecommunication program. In Pakistan, the University of Gujarat has a communication degree program. In North and Sub-Saharan Africa, there are also quite a few. We did a university assessment a few years ago under the Health Communication Capacity Collaborative Project, and identified a number of schools in Sub-Saharan Africa that do provide strong communication degree programs. And some of those are Jimma University in Ethiopia, Daystar University in Nairobi, Kenya, Muhimbili University, it's the Health and Allied Sciences program in Tanzania, Makerere University in Uganda, Stellenbosch, KwaZulu-Natal, and University of Witwatersrand in South Africa. All are very good programs and more affordable for a lot of people in some parts of the world. And in Latin America, there are also a lot of good schools of communication, but one of them that focuses on health and development communication is the Universidad del Norte in Colombia. So there are a lot of schools to consider. As I said, I think if you explore the different options available to you, it's important to look at their curriculum and see which ones seem to provide strong training in theory and research, and not just communication practice. because it's the theory and research skills that will help you to find jobs in communication for social change, whether it's called SBC or not. So as I said at the beginning of this conversation, different theories emphasize different things, and they can all be correct under certain circumstances. So the important thing is for you to try to understand your audience and the things that influence them to act in a healthy or an unhealthy way. And so based on that understanding, you can select the theories that address those issues most clearly. So again, for example, if a particular health issue is frightening, right? Ebola, right, is a terrifying disease. HIV can be deadly. Malaria can be deadly. So if a health issue has some kind of threat or fear associated with it, then you'd want to think about one of those theories that talks about risk and efficacy. So the EPPM model that I talked about earlier, focuses on how do people perceive the risk that they face, and what do they think they can do about that. Another example might be if you're dealing with a behavior that has that's strongly influenced by social pressures or by community members or peers. This might be something around, let's say, adolescent reproductive health, right? What your peers think about early sexual debut. That might be an important factor to consider. So you would want to look at theories that address these social influences, so theories of social norms, or a social learning theory. This is the one that social learning theory comes from Albert Bandura, and it's a theory that we often use to develop our communication programs based on modeling positive behaviors. So theories like that where you can see what someone else is doing and see how they are, how people influence each other, would be an appropriate theory to use in a case where the behavior is strongly influenced by the behavior of others. So, again, the important thing is, don't start with a theory and try to force it on a program. Right? Think about the behaviors that you're trying to influence and the audience that you're trying to serve and support. How do they behave, and what influences that behavior? Based on that, choose a theory that reflects that reality.
Great. All right, let's see. I think that has been pretty good. Any last words or remarks for folks on Springboard?
One of the questions that was asked was whether there are any gaps in our theories, and I would have to say that over the years we've not been very good at thinking about behavior over time. Right? We often think about behavior as something that happens momentarily. Right? We want to get someone to stop smoking, so we encourage them. We try to get them to stop, but someone has to always stop. Right? They have to continue to stop and not smoke again. Think about diet. We often want to encourage people to eat more healthy food or reduce the amount of sugar or salt in their diet, for example. But that's not a one-time thing. That's something that you have to do over a long period of time in order to be healthy. Think about exercise. Right? We want to encourage people to be more physically active, but that doesn't mean exercising once and stopping. It means that you have to increase your level of physical activity all the time, right? Constantly over many years in order to be healthier. So one of the gaps in our theories is about how behavior is sustained over time. And we know a lot about how you can get someone to start a behavior, but we don't really always know what we need to do in order to keep people maintaining that behavior over longer periods of time. So there are a lot of opportunities for us to develop better theory about that, about sustained behavior. And some of the factors might be, social influence, support from friends, social capital. Social capital meaning, do you have, people that you can rely on that can help you achieve the things that you want to. There are some newer frameworks, like the health competence framework I talked about earlier, that helps people to develop the skills they need in order to be proactive about their health. If you can help people to sort of know where to find health information, or be confident about their interaction with health services, right? Those are skills that you can apply to almost any behavior and over a longer period of time. So theories that talk about those facilitating factors, may be important for us to be developing and considering. And then finally, there is a concept called gateway behavior. Some of you may be familiar with the idea of a gateway drug. We sometimes talk about marijuana or tobacco or something as a gateway drug that leads to the use of even more dangerous substances. But we can sort of turn that around in a positive way and say, are there some behaviors that we could teach people early in life that would facilitate their healthy behavior for the rest of their life? We've done some research on this in Nigeria, looking at antenatal care as a gateway behavior. If we can get first-time mothers, first-time pregnant women, to access antenatal care at the sort of the level that's recommended by WHO and by other health authorities, can that lead to subsequent behaviors around safe delivery, around neonatal care, around postnatal health for the mother, immunization of the child, infant feeding, breastfeeding, and so on? I think it's important for us to think about what some of those gateway behaviors might be in our field, and I think there's a lot of opportunity to develop theories about that kind of facilitating behavior that has long-term effects.